Okay, let's talk about myth number 2. You must take drugs to control diabetes. Unfortunately, this is what the medical industry imposes on all patients suffering from type 2 diabetes. The question is it the most efficient and healthy way to control diabetes and reverse it? Or is it just a quick fix to lower the blood sugar levels, which, granted, are dangerous, and just continue on with the drugs because it's easier and more profitable this way? So, this is the basic question. Just because it's the easiest way to control blood sugar, does that mean it's also the most efficient? Especially when it comes to the long term vision of the patient's health, right? And when it comes to your health, to your long term health. Unfortunately, this is yet another example of the medical establishment which treats only the symptom, not the real root cause. Because if they would treat the root cause, they wouldn't need to treat the high blood sugar levels because they would automatically disappear if the root cause is treated accordingly. If you want to truly reverse your diabetes and lower your blood sugar, then changing your lifestyle habits is the most efficient and the healthiest way to go, because this is the way you treat the root cause. Because as you'll see in later lessons, you'll understand completely how your diabetes developed and why the root cause of your type 2 diabetes development is the accumulation of stress factors over time that your body cannot manage anymore. Okay, so if you want to target the root causes of diabetes, you have to change your lifestyle habits and change them from the healthiest ones to more healthy and empowering ones. Lifestyle habits such as nutrition, such as exercising, and when I mean exercising, I don't mean running on a treadmill or something like that. Changing your sleep patterns and improving your quality of sleep, managing your chronic psychological stress levels, and so on. But the question is, will you? Will you be able and will you be willing to change these lifestyle habits? Because believe it or not, even if most people know what to do, they won't change their lifestyle habits because they're so ingrained in their habits, in their day-to-day life, that it's almost impossible for them. However, if you're motivated enough and if you will also implement the secret strategies and tips that I'll share with you later on in this course, change can be much easier and smoother than it's supposed to be, which is supposed to be very hard. So what's the conclusion to this myth that you must take drugs to control diabetes? The conclusion is that blood sugar reducing drugs are indeed helpful at times, especially in the beginning when the patient is very confused at what he or she should do to control their blood sugar levels, because high blood sugar levels are toxic to all the organs in your body. That's why it's so important to keep them at bay, or to keep them as low as possible, as close as you can get to normal values. Okay, so in that stage, that they're very helpful. They're also very helpful when implementing the longer term lifestyle habits that we talked about. However, they're not a long term solution. Unfortunately, maybe 80 to 90% of people who start taking blood sugar reducing drugs such as metformin or others, they slowly transition to injecting insulin just to control their day-to-day blood sugar levels, which is not healthy, and it's not the way it's supposed to go on the long term. Okay, so to conclude this, blood sugar reducing drugs are indeed useful at times. However, they're not the solution to the core problem, and they do not treat the root cause. Treating the root cause would mean changing your long-term lifestyle habits. This is the real solution. This is the real long term healthiest way to go if you truly want to reverse your diabetes and restore normal blood sugar levels.